If you're turning 65 looking at Medicare for the first time, there's a couple of myths that need to be exploded here. And we're going to talk about those. One of them is that Medicare is free, and the other is that I can change my plan anytime I want and can't be denied coverage. Yeah, stick around. We're going to talk about those. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, let's talk about that first one, the one that seems to be fairly common out there, and that is that Medicare is free. And perhaps you think that, or maybe not you, but other people think that because they've been paying into Medicare most of their working lives by virtue of payroll taxes. And so they just assume that when they get to 65, Medicare is free. Well, nothing could be further from the truth. Medicare Part A, which is hospital inpatient, is what you have been prepaying for, in effect, for the last 30, 40 years or so. Medicare Part B, which is outpatient health care, on the other hand, is something that if you want it, and you better want it, you have to pay for. There is a premium for Medicare Part B. So yes, Medicare is not free. Is no free lunch in life. You should know that by now. But no, you will have to pay something. It's compared to the value you get, it's really not that much. The other thing is people seem shocked to know that Medicare can actually refuse to insure you. And yeah, there are some situations where you can be rejected for a Medicare insurance plan. That would be a supplement plan, also known as Medigap. Now, the interesting thing is when you first go on Medicare, you have a 6-month window in which to apply for a Medicare supplement plan without answering any health questions. And for some reason, people bypass it at that time. And they say, well, I can always switch into that if I need to some point in the future. Right now, I'm going to take this other PPO plan that looks like what I've had before, and there's no premium to it. Well, I got news for you. If you refuse your first offer for a Medicare supplement plan or an opportunity to get a Medicare supplement plan, and you come back at some point in the future and you say, okay, I think I'd like to have that now, you may be surprised to know that yes, you can be rejected. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.